Hello everyone. This is a phenomenal medical school. Where it starts is 135 years ago, when our predecessors had put together an engine of eminence that has defined not just the health of you and your loved ones, the health of Minnesota, the health of the nation, and in many instances, the state of medicine across the globe. So how did we get there? Perspective and context are core to the practice of medicine, whether this is for the health of the patient or community or for understanding of the impact of our medical school. Here at the University of Minnesota, this medical school has been recognized as a pioneer team of educators, researchers in a large range of fields that improve clinical care. That legacy drives our work today on behalf of the future generations. It's our core mission, educating and training future physicians in Minnesota. It requires good relationships with hospitals, with healthcare systems, with clinics throughout the state of Minnesota. In the joint clinical enterprise that we have put together with our Fairview colleagues, we have been able to improve quality and safety, market share, productivity to the point that our ambulatory surgical center is #1 in Minnesota. Speaking of partnerships, CentraCare in St. Cloud and with Dr. Holman, we've been able to put our minds and teams together and opened a third medical campus for this medical school. We paired this in our regional campus in Duluth in expanding its program to full 4 years, again, partnering with the clinical systems there. Which means that for the first time in 50 years, we are training more physicians in the state of Minnesota. We are also partnering with the state of Minnesota to expand residency programs in rural communities. With the state's help, the primary care physicians are training in communities where they are most needed. If you want to have rural physicians, you get the young adults from the rural areas, you train them in the rural areas, and, wait for it, they come back to their communities to serve as clinicians in this. So we have 55 sites around the state of Minnesota where we train these rural physicians. We are present in more than 60 counties of the state of Minnesota. And I can tell you that I show up. So I had, I think, 15 different visits across the whole state of Minnesota, from Winona to Roseau, Hutchinson, Moose Lake, and I owed a profound debt of thanks to all of them for their mentorship of our students, for looking at us as partners, and for letting us learn from them, because they are magnificent. And I, for one, believe in rural life, and healthcare is a huge part of rural life. Our legacy in research innovation arguably fueled the development of Minnesota MedTech. You can look at Medical Alley, Greater MSP, and so forth. And it's so important for our core that these are academic physicians that always think about tomorrow. So our focus has been in several things that will be familiar to you: in cancer, in infectious disease, aging, in neuroscience, in cardiology, and it all has wrapped around the whole clinical team. We don't train just physicians at this university. There are whole clinical teams. The good examples would be our collaborations with College of Science and Engineering, Institute for Engineering and Medicine, our collaboration with the College of Education and Human Development, that is the Masonic Institute for Developing Brain, or it can be with the School of Public Health on our Center for Learning Health System Science. And I have always been grateful for the people who understood that we need philanthropy in all of this common endeavor. It all means that you, our supporters, and the teams inside of the medical school gave people in this state the most precious gift I know about, which is a gift of time. This is the gift of time that a 6-year-old girl has, that she's gonna grow up and have children of her own. This is the gift that somebody like me would see their granddaughters at the wedding. This is a gift of time and a freedom of ability to move around and think well. That is, in my opinion, the cardinal value that medicine can bring to people who are injured or suffer from a disease. Academic medicine is the best possible clinical outcomes that are informed by science and being transmitted to the next generation that can take it from here. Now, that's noble in purpose, frequently ingenious, and has to be courageously pursued.